Work is underway. It's still going on to try to create the first generation of men who are free of prostate cancer. Runners and walkers are heading to Dunkin' Donuts Park in the fight against prostate cancer early next month. Here now to talk about the upcoming event and shine a little more light on the disease, I'm happy to have Dr. Joseph Wagner, Peppy Wagner. He is the director of robotic surgery at Hartford Hospital. Also here, a patient, retired deputy police chief from the Hartford Police, Neville Brooks, a familiar face. Gentlemen, thank you. A pleasure to meet you.
Nice to meet you.
Good to have you here. Thank you for taking time, Doctor. A military man yourself. You're just looking at all the pictures right there. All right, in the time we have, why don't you just get me up to date with where we stand right now in the fight against prostate cancer? We know it's treatable. We know we have a PSA test, the prostate-specific antigen test. So, all right, we have probably more weapons in the fight than we do against, say, pancreatic cancer. But where do we need to go from here? And where are we going?
Yeah, so we need to do a better job. So we have all these things, but there's still a lot of guys who get prostate cancer. It's the #1 cancer of American men and the #2 cause of cancer death. So still a lot of improvements that we could make.
Yeah. Well, Mr. Brooks, tell me your story. When were you diagnosed?
I was diagnosed in 2010.
Okay.
And I had a family history of prostate cancer, so I was fortunate when I got diagnosed to be introduced to Dr. Wagner.
And how did your treatment go? So please just sort of take us through this.
Sure. So my treatment was I was given the options by the doc, and I opted to have the prostate removed. I had the surgery. So I had the surgery. I was at the time fortunate also to be involved in a clinical trial with hyperbaric oxygen administered to me. So, and it went well. I had I always tell everyone that. At the time, I was in pretty good shape before my surgery. Yes. After the surgery, and as a result of the surgery, I'm in better shape now than I was. So it's something that I'm trying to get the word out and have make everybody aware that you shouldn't wait. You should get diagnosed. You should treated and move on with your life. They
always say being in great physical shape helps so much when you're trying to fight cancer, and you look like you're in great fighting weight shape right now. Well, doctor, okay, tell me first about the event that's coming up right here at Dunkin' Donuts Park and how that's going to help.
Yeah, so we're partnering with Zero Prostate Cancer. We had a race last year. We raised about $75,000 for prostate cancer research. We're shooting for $100,000 this year, and we're looking for runners, walkers, donors. Any level of participation would be welcome.
Okay. Where are we the most deficient in the fight against prostate cancer? Is it the treatments? Is it the therapies? Is it dealing with sometimes the side effects that comes with removing the prostate?
Yeah, I'm going to be very vague here.
Yeah,
it's all of it. Yeah. It's the diagnosis. We're probably overdiagnosing some men who don't need to know that they have prostate cancer. Yeah. And then they have a difficult decision of being treated or not treated. So if we could decide ahead of time who doesn't need to be treated, don't even find out about it. And then once you have it, we're honing in on better therapies. It's still mostly surgery and radiation, sometimes lowering the male hormone testosterone, and those lead to side effects that we've lessened over the last few decades, but again, we could do a much better job.
Yeah, it's a weird thing about prostate cancer. They say that if you get it at an old enough age, it's a cancer that you die with, not from. So there is a decision to treat or not to treat. Neville, in your case, I imagine, given that you're relatively young, this was a no-brainer to go ahead and treat?
Yeah, it was. Again, I had a family history of it. My dad died of it 2 years prior. I had a couple uncles that died of it, and my age at the time, to me it was a no-brainer. When I went and saw the doc, I already made my decision that I was going to have it removed and move on with, again, with my training, with working out. So.
Okay. So if there's one last thing in the short time we have, one last message you want to get to the gentlemen out there, the guys out there at any age, what is it?
Yeah, I mean, get treated, get diagnosed, make sure you're going for your test, and then, make your decision. Start working out and live a healthy life.
Okay, well, gentlemen, thank you so much. Once again, Dunkin' Donuts Park coming up. It's a great chance right there, Saturday, June 10th, the Zero Prostate Cancer Run and Walk. If you can't make it, you can also consider donating to the cause because it's still, I think, maybe about 140,000 men in the U.S. who are dying from prostate cancer each year, somewhere in that neighborhood. That's far, far too many. Gentlemen, thank you so much for the time.
Tim.
A pleasure to meet you, sir. Thank you.